Assalamualaikum warahmatullahi wabarakatuh. Good morning and warmest greetings to all distinguished speakers, professors, and all participants. Welcome to the guest lecture on Geospatial Perspective to Public Health and Pandemic Preparedness. Today's lecture is presented by Center for Child Health Pediatric Research Office in collaboration with Department of Biostatistics, Epidemiology and Population Health, and also Department of Health Behavior, Environment, Social Medicine, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. Ladies and gentlemen, my name is Rizky Adinda as the Master of Ceremony for today. And first of all, we would like to express our gratitude to all participants who joined this guest lecture, both in the auditorium and virtually through Zoom meeting. Today, we are truly honored to have our inspiring speaker here with us. Please allow me to greet them all. The first speaker is Lucas von Tobel, PhD, as the project manager from Novelty. Welcome, doctor. And the second speaker is Bapak Anis Fuad from Department of Biostatistics, Epidemiology and Population Health, Universitas Gadjah Mada. Today, Pak Anis will be joining the guest lecture virtually through Zoom meeting. Ladies and gentlemen, for the lecture session, we will be facilitated by Dr. Daniel, Master of Science, as our moderator. Dr. Daniel is an assistant professor from the Department of Health, Behavior, Environment, and Social Medicine. As you can see on his CV, he has a great interest and wide experience on water, sanitation, hygiene, and also environmental health. Dr. Daniel also a member of the Environmental Health Expert Committee, Ministry of Health, and member of Indonesian WASH Network. Maybe we will just start our lecture session, and for this session, we will hand it over to our moderator. Please welcome Dr. Daniel.
Yeah, good morning, everyone. I see some people. Can we see people joining from Zoom somewhere? So we know the faces who are joining right now. But yeah, thank you and thank you for joining this guest lecture. And we have a wonderful speaker far away from Europe and from UK. So, but we have only one of them will speak today, and we have also Pak Anis will who join online. And yeah, and the guest lecture for today, we will talk about the geospatial perspective to public health and pandemic preparedness. And this guest lecture is part of projects Typhoid Wastewater Environmental Surveillance from Center for Child Health here from UGM. And we are very happy to have distinguished speaker from Switzerland, and I hope you can learn a lot of things. And you will speak for about 30 minutes, and then we will call, and then the second speaker, Pak Anis, will join also and will give a speech for 30 minutes, and then we will collect any questions, and we will have a discussions after the presentations, okay? And for people who are joining online, I cannot see your face, but if you have any questions, just type it on Zoom, and then someone will deliver the questions to us, and we will discuss it directly after the presentations, okay? So, and for the audience, if you are not confident to speak in English, just speak in Bahasa, ask any question in Bahasa, and we will try to translate it into English, okay? So don't worry, there is no language barrier in this room, okay? And yeah, I think that's all from me, the introductions, and I want to invite the first speaker, Dr. Lucas von Tobel from Novelty Sarl, how do you speak this? Okay. And yes, let's give a round of applause to Lucas. And I hope you can introduce a bit about your company so everyone may know about it, and then you can give your presentations. And yeah, Lucas is a software project management, has a lot of expertise, software project management, medical devices, and especially of course the geographic information systems. And he served as a project manager at Novelty Sarl from 2020, and leading a lot of projects with different organizations. And this is the interesting thing about him, that he is graduated from biochemistry, cell and molecular biology from Switzerland, and now he switched a bit to geospatial things. So it is very interesting for us to learn about his expertise and his company and everything that you are doing right now. So the floor is yours, Lucas, for 30 minutes. Thank you.
Thank you. Good morning, everybody. It's a pleasure to be here. I will be indeed talking a little bit about topics that are across public health, what we do at Novelty, and I hope this is going to be interesting to you. So if we go forward, I think, no, this was the one forward. No, it doesn't move. Where do I point with the, is it like that? Is this? Aha, okay. Okay, I think I got it. There we go. Okay, so I will be giving you a quick introduction about Novelty, what we are, what that company is, and then I'll introduce, for the ones of you who don't maybe know GIS very well, what are geospatial databases. Then we'll talk about basically 3 use cases of how we apply at Novelty GIS to public health, namely in microplanning, which is going to be a tool that we introduce for doing microplanning, monitoring interventions, and then we'll talk quickly also about environmental surveillance, and we'll end by introducing artificial intelligence and how we could apply that to identifying sewerage-related features. So basically, quickly, what is Novelty? We are a Swiss company based in Geneva, and we exist since 2012. It was a company founded by WHO Information Systems engineers, so it's a company that exists since 14 years. It's about 30 people that are working in this company, and we work mostly on public health and social impact projects with the UN governments. And we provide services around information system engineering. We have a strong expertise mostly in geospatial information systems and significant field experience deploying these solutions at global, regional, and local level. And importantly, we want to strive to generalize the solutions to support different programs and countries. So this is quickly what we are now. Our focus is mostly on 3 plans. So we help planning geospatial interventions using geospatial databases and doing microplanning. We also monitor using geospatial tracking systems, georeferenced data collection, when people use devices to collect information. And then we also do the evaluation part where we integrate, harmonize data, and we visualize it and make it accessible so it can be useful for interventions. With that, we're going to shift to the geospatial database part. So I want to just mention that there are 2 types of geospatial data types. I think maybe all of you are familiar with this, but I think it's good that everybody's on the same page. So there are vector data sets, and then there are raster data sets. This is just important so that we can get all of the rest of the talk aligned. The vector data sets are essentially in 3 types. So the first one is points. These would be typically settlement names, health facilities, markets, schools, etc. So these are typically represented as points. Then we have polygons, where boundaries of a province, and these are very important for public health purposes, are depicted as polygons. And thirdly, which are lines, can be roads or rivers, for instance, that are depicted as vector lines. On the other hand, we have raster datasets. Raster datasets are typically cells where pixels have a given size, for instance, 100 by 100 meters, and they typically contain one single value. It could be imagery, so a satellite image is a raster where each pixel has a color. But for instance, an elevation model where each pixel has a value of elevation, or a population model where each pixel contains a person value. So these are sort of the main fundamentals of geospatial databases. Now, for public health, it's important to have a minimal geospatial database that typically consists of boundaries. As I've mentioned, the administrative boundaries are important to have in place because anything that follows will be based on what are we talking about in terms of geography. The second important notion will be settlements, so what are locations, extents, and names of settlements, so that we know if we're going to have an intervention somewhere, what is the name's place and what is the extent of that place. Population estimates, we need to know how many people are living in one place, and ideally this is GIS based, so we know where the people are located exactly, not only by an association with a name, but actually also in terms of a spatial extent. Then the points of interest, so these would be markets, schools, etc. And roads, which are important to go to places, and finally also water bodies to inform which might be barriers to cross if we go from one place to another. So this is what typically a geospatial database consists of in the context of public health, if we're just talking about planning an intervention. So to illustrate this, maybe I just want to show you one comprehensive database, and what you can see here, essentially the first boundary this is an example from Nigeria, where we have an administrative boundary. We put on top of that, we put the settlements in extents. So here you can see the urban areas are the ones that are gray here, and we classify them in urban areas, and then we have rural villages which are slightly bigger than the hamlets. These would be urban areas which are the biggest, so we sort of have a classification of which are the types of settlements we are dealing with. On top of that, we can put a raster. This would be a population raster where the cell values here are more dense to less dense population. And on top of that, we can put the population values. So each raster cell has now a value. And if we go further, we can now also put the names in places, so we can name everything. And finally, we have the subnames. So within urban areas, we potentially want to label all of the different sub-areas. If we need to go to different places within a village, we need to also know these places. And then we put the hospitals, the markets, schools, etc. on top, so that would be the point of interest. And finally, we have the roads. So that's sort of what is the geospatial database consisting of, and that's the information that we need to plan an intervention. So such a geospatial database can be typically assembled from two, let's say, approaches. So one is from the top down. So these are data sets that we can create without having to be on the ground. And this would include, for instance, the settlement shapes and polygons. We can actually create from satellite imagery, and we can then create a settlement polygon out of that. The roads we can identify also from remote sensing. Water bodies we can identify from remote sensing. Whereas on the other hand, boundaries potentially we don't need to be on the ground. That will depend though, in some cases that is absolutely necessary. And then we can use a bunch of those data sets to create population estimates from. Whereas on the other hand, there are bottom-up data sets where you need to be on the ground to create those data sets. So for instance, the settlement names, well, we need the information from the ground. We also need, for population estimates, sometimes we need to verify that they are correct, so you need to do potentially household surveys. Then the boundaries, again, in some cases you might have to identify which are the boundaries on the ground, so that depends. And finally, points of interest, we can typically not identify. Sometimes from satellite imagery you could potentially identify how a big hospital could look like. That might be feasible to do, but in other cases, or church maybe, or a mosque, you could potentially identify also via remote sensing, but it's currently still mostly done from the bottom up. So if we think about how we can create these settlements, this is just an example. So here you have a satellite image of a bunch of settlements here. And what we can do with this is we can run a building extraction algorithm on that using transformer or CNN extraction method, so to say. You can see all of these yellow shapes now are the buildings that have been identified on that image. And then to use this information in a database, it's more useful if used as a settlement instead of individual buildings. Individual buildings can be very hard to work with, but because if you think about a country, there will be millions of those, so that's difficult to work with. So typically what we then do is we aggregate them into settlements that you can see. This is now this urban settlement in blue, and then you have these or let's say peri-urban, and then you have the what we call hamlets in yellow, which are the individual houses, so to say. And then we can use to create the boundaries, for instance, from the bottom up. One way to do this is to collect settlement points and settlement names and points of interest, collect them in the terrain using a device, and then when we collect that, or when the people collect it in the field, they can associate an administrative boundary with that settlement point or the point of interest. And if you do that, then what you will get is sort of an image like that. What you can see here, these are individual points, for instance, settlement points. And these settlement points, they all have an administrative boundary attribute with it. And if you group them together, you will get something like this. You have all the points that are aligned belonging to the same administrative boundary. So you get these kind of strange shapes. But at least that gives you an idea what the administrative boundary looks like, more or less. And then you can use some sort of Voronoi polygon algorithm to try to reconstitute the administrative boundaries to some degree. So that can be useful in cases where your administrative boundaries are really badly mapped. So that's one way to do this using, for instance, demographic surveys. In the demographic surveys, you can also use GIS. So GIS-based population models can be inferred using those DHS surveys that exist. So in this case, we know how many people live in a household on average in a given area. So we can sort of sum up these. So here again, this would be demographic survey points. These are microcensuses of a bunch of individual houses that have been surveyed, and in that zone, for instance, we know 5.4 people on average would be living in a house, and because we have extracted all the buildings, we can then disaggregate this population to each house and create population estimates based on that data. So that's sort of the way we can assemble these databases, which can give us the population per grid square that we've seen just before as well. So with that, I think at the end of this introduction about geospatial databases, and I'm going to talk about now 3 different use cases that we have at Novelty in applying this geospatial databases into an actual tool or intervention. So the first one, we'll be talking about microplanning. How do we use the GIS tools in the context of microplanning? And what you can see on this picture is essentially in Nigeria, a bunch of microplans that are used in the context of routine immunization. So you can see these are hand-drawn maps of people locating their health facilities here, then the roads, and then they potentially attribute population to these different places. And you can see that this is these maps are drawn to the best of the knowledge of the people in the health facilities at these moments, but you can clearly see the obstacles using this in any further down planning. You will have to for instance, if you want to update this information is on paper, it's going to be difficult to update that on a, let's say, sustainable way. So one way to go about this is, and maybe one thing that I should add here is exactly that at this stage here, everything that is on this plan is based on the knowledge of the person who is drawing this, whereas at this moment you don't know what you don't know. So if there is potentially a village that this person who is drawing the map doesn't know about, well then you're not going to be there, you're not going to serve that community. So the idea of using geospatial database in this context is that you can include unknown settlements. So if you have satellite imagery, you know where all the houses are in that area. So that clearly gives you an idea of, even if you did not know that there was an area, you could go there. This also gives you the opportunity to now compute distances. So in some countries there are fixed post outreach sites that are being defined as a certain type of strategy. So anything beyond 2 kilometers from the health facility or anything beyond 5 kilometers of the health facility is considered an outreach site. So you can now calculate these distances. You can also, if you use a geospatial database, you can use that to estimate population in terms of size of the settlement extent, and you can also have a reliable way to resource your requirements. So whatever it is, vaccines, for instance, you can now reliably plan that, and you have the means to monitor that intervention. So now you have a plan, and the plan is a digital plan that you can now use to monitor against, which is also something that can be very useful. And this allows you to basically now know what we used to not know. So essentially you're in a better place to start doing that. And so one platform that is owned by WHO that we have been putting in place together with WHO is what is called Geopod, where you have geospatial databases. It's an open access platform, if you wish, where a lot of geospatial data for different countries all around the world are let's say aggregated, and you can see that, you know, here for some countries you will see that there is population information, there is settlements, boundaries, points of interest, shapes of interest, and depending on the country, some of that data is available, and for some of that data is not available. We now can use this geospatial database to put that into a planning tool. And that planning tool that we're talking about here and that I'm going to introduce is called this Geospatial Microplanning Toolkit. So the idea of this tool is that we essentially have a geospatial database that can be deployed in the field, and that database can then be used to have population estimates, settlements, health facilities, points of interests, and the boundaries, administrative boundaries, which can be reviewed in the field and can be by health workers. They can look at that data and then update that data with local knowledge. So there is this feedback loop of whatever data needs to be updated is being retained, and then they can review catchment areas, plan outreach sites, and then export the data for their for instance, for the health facility. So in concrete, this is what this tool looks like. So this is deployed for being used on a tablet or also on a computer screen. What you can see here is essentially an administrative boundary name. So this would be this is a ward in Nigeria. It could be a district or a sub-district in another country, and you have a list of the health facilities in that particular ward. And then you have a tab here, which is the settlement tab. So you see all of the settlements in your area, which are these yellow markers here on the map. All of these yellow markers are different settlements. The blue things that you see are the health facilities, and then the green little points here are what they defined as outreach sites. So the health workers in these cases, they decide, okay, in this health facility we will go and provide outreach services in these locations. You can see that they all have sort of these little lines which indicate that a health facility will provide this outreach service, and so on. So this gives them a map on really showing where to go at what moment during the month. And you can also see that we include the population here. So you see up here is the population figure for that entire boundary. So that means there are about 200,000 people in this boundary, and they're all being served. So the blue color essentially means that they are all within a fixed post catchment. So in the case of routine immunization, and then all of the green that are above maybe a third or so are being served by outreach sites. So this is one example how we can leverage all of that geospatial information to precisely put a plan in place how to monitor the population in the context of routine immunization. And this also then can be aggregated at the entire let's say this is now, before we were looking at one operational boundary here where they planned this intervention, we can then aggregate all of that up to, for instance, the next higher level in the geographical level. So this could be now a district when it was a sub-district before, and for that district we then get the statistics on how the planning has been implemented, how many health facilities exist in that ward. So it's giving a snapshot of how many people are being served by what type of strategy and what kind of health facilities are available at that place. So this tool has been deployed in Nigeria in 2 states, serving about 1,000 health facilities, and the output of that is then something where you go from a plan like this, well, you then end up with a concrete PDF that you can potentially hang up in your health facility if needed, that shows you what you're being served. And what I think is interesting to see, so we did not do a report on this, but one of the partners we worked with, they did an analysis after that implementation, and you can see this is this hand-drawn map that was used in one ward versus then the map that was used in GMT in that tool. And you can see that, for instance, you know, here this place Fellar here, how it was drawn. Here's the health facility. You can see this is the actual plan right now. You can see that, you know, the visual concept is clearly quite different from what has been in the head of that person who drew the map. And the distances, obviously now you have distances that are calculated. So these are all calculated distances where they didn't have these distances before. And it gives you a better understanding of which services you probably have to do in an outreach setting and which you have to do in a fixed post setting, and how many people you need to serve these areas in that case. So that's the use case example I wanted to show you for microplanning. Now the next example I'm going to talk about is monitoring interventions. So here we are talking about monitoring a plan or monitoring a simple intervention that you want to sort of get an insight on how is it being deployed in the field. And for that, what we are using is called a Geospatial Tracking System, a GTS. So this is what this acronym here stands for. And there are 2 modes you can monitor. You could think about monitoring passively, so that's a health worker carrying a phone or a tracking device around if you wish, in a backpack or whatever, in a pouch. And that will allow just simply monitoring the person or the intervention where it is going. On the other hand, we can also use active tracking where, you know, people can enter information in the field. So it could be how many people we are being vaccinated at that site, or it could be or where are these people living, etc. You could do any field collection with that. Now, this system essentially comes with a geographic coverage calculation, if you wish, so that when people who are walking the field, we can monitor against what they were supposed to do. So you can imagine that we have now a plan that we know they should go to location A, to location B, to location C to vaccinate. And we can check, did they go there? If they went there, then we can see that, you know, the geographic coverage is being covered, whereas we can also monitor the population that they were supposed to cover. So on the one hand, we know the location they have to go. On the other hand, we know how many people they have to visit. So that's sort of 2 indicators that we can calculate. And obviously, we can also have different teams monitoring, and we can also collect data. So this is sort of what I'm going to show you in that next video that you'll see here on this slide. So, whoops, that skipped. So here, let me go back if I can. So here you see this health worker going from house to house, and each house that is being visited turns green. Each house that is skipped essentially remains red. And what you can appreciate is that we have a trace where that health worker went, and it gives us these green areas which have been visited and the red areas that have been missed. So this is let's say the area that people have visited, where you now can see that on these green areas, which are all of these, so all of these have names again. This is the geographic hierarchy that we have in place. We can calculate within the green areas how many of these areas are green, how many are red. So this is sort of the geographic coverage. You can say, okay, within this entire area here, we probably covered about 80% of the places. And all the others have not been visited. On the other hand, we can also associate with each place, we have the population that is living in this place. So if they have visited this place, then we also know how many people have been visited. So on the one hand, you'll get a geographic coverage. On the other hand, you get demographic coverage. And that shows you how the intervention was essentially being implemented. And you can monitor that without having any information on what needs to be done, because you could think about simply you want to see how well they're covering the area in general, or you could even have a plan that you, for instance, created in that GMT. You know, you have a plan, they need to go on day X to place B. And you can monitor, this way you can monitor also if they followed the plan. So this is a way to do that. We can also monitor stationary services. So here you can see that in these 3 locations, for instance, they stayed for about 3 hours or so. You know, these are the time would be indicated how much time they spent at these locations. That shows you then roughly which areas are being missed. So when you implement this systematically, each health worker who is doing a routine immunization service here, you can see that within this area, people should be able to reach the health facility, but all of these red areas here are sort of being chronically missed if nobody is going to provide health services in these areas. So that's how you can use this to monitor stationary services. This was implemented at varying scales throughout 8 countries. The largest campaign so far that we did was 40,000 teams at once in polio door-to-door campaigns in Nigeria. And these are just some images of the zero-dose children that were vaccinated during these activities. One thing that is important here is that you can monitor this in real time. So while you're doing a campaign, you can, on the same day, if you wish, you can course correct your activity. So with that, I'm going to talk quickly about the logistics hurdles. So you can imagine if you have 40,000 teams that you're deploying, it means you have 40,000 devices that you need to deploy. And these 40,000 devices, you need to charge them every day, because at the end of the day, it's a phone that is running with GPS, and that gives you a lot of logistic headache. So one thing that we did to remove this hurdle is we developed a hardware. So what you see here is what we call the antidote. It's a device that is, let's say, roughly the size of a phone, a little bit bigger, and it has a larger battery. So it allows tracking of the campaign of 1 month, let's say, on one single charge. So you remove this entire logistics hassle going back and forth. There is also no training involved, so you can imagine if you want to set up phones to track vaccination campaigns in a country, you need to, on each phone, if you're using Android phones, if you have done that before, you want to install something, you need the App Store, etc., etc. You need to set up a Google account. It takes you forever. So in this case, you basically can skip all of that. You have no training that is involved. You have Bluetooth connectivity, and this is sort of resistant to harsh conditions if there is also light and sun and everything, water. So that's sort of that device that is supposed to get over all of these logistics that you might face. Now, let's go to the third topic, which is using geospatial information system to support environmental surveillance. So a lot of you have heard about this already. So I'm not going to spend too much time on this, but the environmental surveillance aspect of things is that you wanna survey where is disease without having to look at people themselves, because maybe they're asymptomatic, so you cannot deduce whether they have symptoms or not, or where they're carriers. So you need to sample sewage the sewage system to know if there is virus in the sewage. And again, in this case, you could sample from a river and you wouldn't necessarily know what you're sampling because your upstream catchment where the people are contributing to the sample is not known. So you want to use environmental surveillance to do that. And the question in this case is, where do you put your sampling site? And to do that, we developed this environmental surveillance catalog, which allows you to do that. The criteria for site selection are many. You need to know what is the accessibility to the site, what is the flow, what are the fecal indicators, what is the population that is contributing to that sample that you're taking, and in that case you really want to involve the GIS aspect. So here we put in place this system. Again, this is a system now that is owned by WHO. You can see that we can have a map where you have a sample site location, and upstream of that sample site location you get a catchment that is contributing to that location. And what you get here is you get the population and the area from where the water or the sewage is coming from. So this system has been developed again in the context of polio. We established that in 2015 to detect or map the sites first used in Nigeria and Pakistan for polio surveillance. And initially this was a proprietary technology using ArcGIS. We moved that to an entire open source stack, and this ownership is now, again, as I mentioned, with the WHO. The purpose of this platform is again to maintain an inventory of sampling sites and then help the identification of the optimal locations for new sampling sites. We can compute these theoretical catchments for each site, and we can use the population models that we've talked about before to estimate these catchment populations. And we can identify where the positive samples are detected, so that could also give us a link between the laboratories and the samples. And we can show sampling frequency dashboards. So that's sort of the way we can use that platform. And this is just a quick video of showing you how that platform works. So we can create a map for an area where we upload population and digital elevation models. We can then sort of process the map. We get these drainage lines that you can see on the map. We can refine the map afterwards. We can include OSM street data. So this is what you can see here. They can also be imported as a GeoJSON. We can use manual sewage from uploads that we collected in the field, for instance. And we can import sites, the site location in the system, and save and process that to the map. So that basically gives you then these catchment areas. And then when you want to publish this map, you can basically make it available for the entire world to see. So everybody can see where your sampling sites are, and they will have an idea of what activities are being conducted in the field. And we also can show the potential site locations to map where could a site be well placed. So for instance here we're trying to identify, is this a good sampling site location? And we can connect this with the WHO data information system where you can pull in data from other sources. So that's sort of what this environmental surveillance system is about. When you implement that in the field, so this is an example from Bangladesh, you can see that here you have a lot of manually collected data where they mapped the entire sewerage system in Dhaka. And you can see there are a lot of these lines, so that's a lot of work to do in the field. If you want to map all of that, potentially you can get that information from a sewerage authority. But here it has been obtained from field work, so people have walked the streets and identified, okay, there is sewage flows here and here and here, and so that's a lot of work that they needed to do. And that's why we thought maybe we can use artificial intelligence to identify the sewage. And what we are doing here is we're trying to identify sewage related features. So what you can see here are the different features that were identified in Dhaka that are all linked to the sewerage that we can see from the surface, if you wish. And so then the idea is, can we use street view imagery? So here you can see this is on a rickshaw. We can drive a rickshaw and then identify manholes so we have these grids, we have round metal manholes, and we can identify using a CNN in this case, these features directly from the rickshaw. And then the idea is, can we now identify the network behind that? On the other hand, we can use drone imagery. So here you can see that these are the features that we're trying to detect from the drone. And in the imagery on the drone, you can see those two blow-ups. We can also identify those manholes from drone imagery. And more importantly, we can identify the big open, so in Bangladesh, in Dhaka, they have these big open channels that go through the city, which all carry the sewage. So so we can essentially map these areas as well using drones. And then we want to put all of that together so we can identify what is the network behind that. So you can imagine that we have the features now placed on a map, and now we connect them to a network, and then we want to understand the directionality of that network. And so this is essentially what you see here. We have all of these identified features from the imagery, and these are the points that you see here. And then the goal is to create something from these points to create something like that is directed. And so that's a challenge that we are still working on today, if you wish, but we can already do some of the things. I think one of the challenges the three main challenges that we need to place the features on the map, which we can do. We need to connect the features into a network. We can use the underlying road network because we know that most of these features follow roads, so then we can use the underlying road network if we have that to do these connections. And then we need to infer the direction of these roads. That's a more challenging part. We can use the digital elevation model to do that. But in Dhaka, for instance, it's very flat, so that's a very flat city. Then using a digital elevation model is sort of a little bit more difficult. There are different approaches that we do to do that, but we can use attractor points. If we know where are the outflows of the system, we can sort of optimize that. All of that to say that, you know, this is how it looks as of today if we do that. So this is what the ground truth collection looks like in Dhaka for one area. This is where the imagery was done. So this is all the places that were imaged using a street view in this case, in blue. And then in red are all the detections that we had of these features that we are looking for. So here, all of the red dots are one detection that you find on this imaged data. And so from that, we then reconstitute the network, and you can see, you know, we have some gaps because there obviously is no imagery, and then, you know, there are some cases where you have these dots of imagery, but then you cannot reconstitute the network. So for now, we're still sort of in the phase of getting that to a better state. So I think with that, I'm closing here, and I don't know if you have any questions. Thank you.
Yeah, thank you, Lucas. Before we continue with the second speaker, I have one short questions to everyone here. How many of you are familiar with geospatial tools or software? Just want to make sure. Yeah. For the students? Okay. Okay, I hope this can inspire you. So if you have any questions, even basic questions, feel free to ask after the second speaker. Thank you, Lucas. And we move to the second speaker. We have Pak Anis. And yeah, we have the second speaker, Pak Anis Fuad, and he will talk about the geospatial intelligence for pandemic preparedness. So he's one of our digital health expert here in UGM, and unfortunately he cannot join us here, but he will join from Zoom. So yeah, the screen is yours, Pak Anis. Can you try your microphone, Pak Anis?
Hello.
Yeah,
Still,
okay. Yeah, we can hear you.
whether I'm audible?
Yes,
Okay,
yes,
okay.
yes. Okay. Right.
Yes, thank you very much. May I share by myself? Okay, yes. Thank you. Wait a minute. Okay, good morning, colleague in Faculty of Medicine, Public Health Nursing Gajah Mada University. Uh, First of all, I'm very sorry could not joining the meeting today, given that there is other commitment here. But very happy to be invited to speak in this event and also learn a lot from previous speaker regarding the GIS. I think this is also very important to our students. And I would like also to share a little bit that uh, on our experience on keeping a class related to the spatial analysis. I think we need to have more session interaction with students related to the GIS and also the use in uh, public health program. So in this session, I just would like to share a little bit about the issue of intelligence or AI that some of the materials has been discussed before. It is a very interesting and some of the material here that will be discussed more on the reflection, not technical one, but hopefully uh, we could use this material as part of improving our knowledge and learning related to the GIS. Yeah, I think we start with this picture. It is one of famous historical picture in public health about one of the public health technology in that era, a water pump that could be used for people to have uh, water for drinking and other purpose for daily life. But then this kind of picture that after this lady took this water, and then on a few days or few hours, her husband. So it's not only about a sickness, curiosity. And we can see this gentleman, Dr. Jon Snow, who is not only house to house to ask a question, but also to understand what is the missing link, why there are many people a few days. And then we can see that during the time, AI is not at the time. Computer is also, I think, I do not know. It is also still in the. Test, test. Am I still connected?
Yes, yes. Yeah, Pak.
Oh, okay, okay, okay.
But this is not a what do you call this? This
Oh, okay,
the
okay.
percentage now.
Yes, let's use the slide from computer. I think my connection is for share.
Or you can, maybe you can turn off your camera, Pak Anis.
Okay, yes, I will then. Okay, next slide, please.
Yeah, I think.
Okay. Sorry. Okay. Next. Next. Okay. Yeah. I think right now the world has changed. The previous history about Dr. Jon Snow during the limit with the limited technologies and facilities. Right now we have more opportunities, especially to identify any potential outbreaks. We know that there are currently million people, many source of data, flights, social media, mobility, and satellite. I think that's one also could also be possible to be the next generation of Jon Snow. And from the current map of Jon Snow, we can learn that there are many technologies that could be used, and one of them could also be about the AI that could also be possible to support us on how to understand our situation and also preparing any upcoming outbreak or pandemic. Next slide, please. So from Jon Snow, we learned that it is not about the technology actually. It is about um, our endeavor on how to improve health outcome of our population. So we could uh, may please can you check my voice audible?
Masih terdengar, Pak?
Okay.
Oh, we can
Okay.
still
Yeah.
hear you.
Yeah. Okay.
Yeah.
Thank you. Yeah. Yeah. Okay. Good. Yeah. Thank you. Yeah. So we can. I think for us in the public health domain, the example of Dr. Jon Snow give us opportunity to improve our public health with knowledge and also experience and skill to support the health of our population. And I think the technology is coming here to provide us with more predictive, more preventive, and also more personalized technologies to support us. Next slide. So if we compare the map in the left side that was developed in 1854, and then compare to the right side, I think those are a similar map, but I think one aspect that we need also to understand that this map or technologies is expected to life saving, and they are supported with the intelligence for life saving. Next slide. And from the previous speaker, we learned that there are many sources of data that could be used. We first know about maps and also the technology itself, a geographical information system to organize, analyze, and also with our understanding knowledge on epidemiology, we could understand the pattern in terms of space and time of any health problems. And then with the coming of intelligence, we could apply AI for extracting insight, predict, explain. And then with our, I think, um, our visions to prevent or for upcoming pandemic, we could use this kind of technologies to anticipate risk, spread, and also impact. And then we could prepare ourselves to have a smart decision and stronger communities to prepare for the upcoming pandemic. I think the most important of the availability of GIS and also spatial technologies is having us to have opportunities to conduct early detection, targeted intervention like has been discussed before, and resource optimization, impact reduction, and also make our communities stronger. Next slide. So, what is the contribution of intelligence in our daily life? I think we learned that as we have our eyes, our brain, memory, reasoning, and decision. I think without this kind of tool in our body, we could not, as a human, uh, solve the problem. But then with the upcoming technologies, we can contextualize GIS as part of our eyes, AI as a brain, and data and knowledge is part of our memory and reasoning. And then with the intelligence in geospatial, we could also expect it to have a better decision for any kind of problem for preparing on the pandemic. Next slide. I think this kind of evolution of geospatial intelligence, I think Jon Snow among the historical part of our domain in GIS, but then many aspect and detail of GIS function like hotspot detection, risk mapping, early warning. And right now, I think we are going to have a more function like prediction and intelligence is expected to support us for pandemic preparedness. And it should be supported by various of data, either data from health facilities, mobilities, environment, profile of our population demographic, climate, infrastructures, and also social behavior. So when we combine all those kind of technologies, so we will have this kind of geospatial intelligence that is expected to integrate all data and then having this method for spatial analysis and then visualization to support us for better decision making. Next slide. So in terms of pandemic preparedness, we learned that if we could prepare this kind of situation or pandemic, for example, it will save a lot of things. It will save life. It will save also economic. It will save also any other resources. So investing on GIS, investing on spatial technologies is a very good investment to support us for the pandemic preparedness. Next slide. So in terms of the pandemic preparedness, there are four components that is important. First one is surveillance. Secondly is all public health and social measures. The third one is research. And the fourth one is about intervention for life saving. So this kind of component are needed for pandemic preparedness, and also the support of special technologies is important in this kind of activities. Next slide. And we know that the pandemic is not coming directly. We need to prepare first and prevent. And finally, if we could identify and then this kind of any data that are available used for response and control until mitigating for the pandemic. Next slide. There are many examples for a tool on pandemic preparedness. One of this is from a paper I think you can download from the journal. It is an AI-powered geospatial intelligence that include multiple data sources with AI and data processing, and then with visualization platform that also supported with analytic and AI models, and then providing users with actionable intelligence. This is just an example, but I think there are also other examples as well related on the geospatial intelligence. Next slide. This is also another example applied for wastewater. The multimodal data, including, for example, from the map of OpenStreetMap and also remote sensing imagery from satellite, and also other data, for example, climate, that after combining with the workflow of geospatial intelligence, we could provide a visualization, and also using AI training pipeline. Finally, we could have also the input to support our team on wastewater treatment in our area. Next slide. So I think also in the current year, we know that AI is getting more and more smarter. And one of them is also the coming of autonomous GIS. It is also something that will be coming soon. Next slide. And using this autonomous approach, we can see how is the combination and role between human and AI. Seems like when we know that there are also some vehicle with autonomous model. I think this is also could also be possible when we use GIS. Previously, we learned by our hand on using GIS, but later the method on using GIS could also be different. Next slide. Next slide, please go next slide. Yeah, next. Yeah, as we know about using LLM, for example, there are also some other example on how to interact with the GIS tools using approach like prompt engineering, and then we could have also the answer. Next slide. This is also module on QGIS that also having this kind of like a co-pilot function interact with the map, so that we could also have this kind of co-piloting or autonomous model using AI. Next slide. So this is also another example. They say that this autonomous or agentic could also be used like we are using prompt engineering. Ask question. Next slide. And then they say that no GIS degree required. But I think another issue is always about the quality and result and how responsible of data that will be provided by this kind of technologies. Next slide. So I think it is also a good question from Mas Daniel before starting this session. How is or to what extent our students knows about GIS? I think in terms of digital public health competencies, we need to have at least 3 components. Our students should also would have these competencies on health data, digital public health services, but also AI. Next slide. But I think the component on geospatial intelligence, I think we need to explore more and also give opportunities for students to learn more and also adopt and also exercise in our curriculum. Next slide. So in terms of Indonesia, there are a lot of resources to use for geospatial intelligence from the Ministry of Health, One Health, BMKG, etc. So it seems that there are a lot of resources, and I think we need to have more exercise example with our students on how to use this kind of geospatial data resources for public health purposes. Next slide. Next slide. Yeah, so in terms of AI, I think there are several principles on how using AI. One of them, like these futures, as abbreviation of fairness, universality, traceability, usability, robustness, and explainability, is also among important framework on how to adopt and use AI. Next slide. So one of this paper also mentioned how to use a geospatial intelligence that easily understood by user. So they adopt the explainability features in every model that they develop, and also the map, and also adaptability if the model previously developed in London or New York, but then when they adapt in Indonesia or Nigeria, how to be adapt, and also the sustainability features of this geospatial intelligence. Next slide. So to develop this geospatial intelligence, I think we need to start with engage with the multidisciplinary stakeholders, including who own the data from the health facilities and also other sectors, Dukcapil, etc. And also define intended use for what purpose, and then define a clinical setting or public health setting, and then define source of data heterogeneity, and then ensure ethics and privacy governance in geospatial intelligence. Next slide. So I think this is also among uh, the question right now. We have this kind of weather forecast in some media, in TV, for example, but we do not have such kind of pandemic forecast. And I think one of the pieces, because we do not have this, is we miss the geospatial intelligence. Next slide. So I think that's all from my side. I think hopefully after this session, more and more students are interested with the spatial and having research in spatial analysis and public health. Thank you very much, Mas Daniel. Sorry for this inconvenience for the internet connection.
Yeah, thank you, Pak Anies, for your talk. Yeah, I want to invite Lucas to come in front and join me for the Q&A. Yeah, anyone from the room? I will start from people here. Anyone want to ask questions to our speaker? We have Lucas and we have Pak Anies. Oh yeah. Yeah, you may introduce yourself first and then can ask your question.
My name is Atta Dhanindra Zakiwibowo. I'm from Faculty of Medicine, FKKM KUGM. So my question is to both speaker or one of them, is how you differentiate between an outbreak and something like a common flu that just happens seasonally, since both of them can happen at a constrained location and with a high infected individual. I think that's it.
Okay, maybe we will collect more questions and then our speaker will answer. Anyone from in this room want to ask questions? Nope. Oh, ya. Tapi nggak kedengaran di online.
So my question to Lucas. Yeah. So if resources were limited, perhaps like in Yogyakarta, so you could sample only for perhaps 3 to 5 sampling sites. So or location, how would GIS help you decide where to collect this wastewater sample?
Okay, yeah. Thank you, Prof. Ita. Anyone want to ask questions? Or oh yeah, okay.
Sorry, I'm just curious. Maybe the question for both speaker. So maybe based on your experience also, Lucas, in other countries. So what governance structure that you recommend to manage the GIS, especially for the pandemic itself? Because we have like different tier of governments from district, provincial to the national level, and how to make it works, like different level of administrative work. Yeah. Thank you.
Okay, I think we have 3 questions from 3 people, and I will start from Lucas. Do you want to ask? Do you want to respond to?
Yeah, I can respond to the second and third. I think the first one is more an epidemiologic question, and I'm not an epidemiologist, so I don't want to wade in the wrong waters. So I think the limited resources regarding setting up sites, I think it will depend on your question. If you want to cover most of the city, GIS would be very well suited to help you in this context, because you will show with your individual catchments how much of the city you can cover with the sites that you can put in place. So if your goal is to cover the entire city, you will try to strategically place your sites in such a way that most of the area is being covered. On the other hand, if you have questions about, for instance, marginal populations, then if you know where these populations are located, again, GIS will help you to identify the spots where you want to survey these types of populations. And again, the GIS will be crucial in that aspect, because you will have to know what is the catchment area that contributes to your sample in this case. I think the key question here is also if your system is converging, because if your sewage system is not converging, then no matter where you place your site, you will not capture enough people to cover a substantial part of the city. I hope that answered the question, Inda. The second question, Wika, I think is that's a very, as you say, we see different ways how this is handled. So firstly, the geospatial data sets that we typically work with, they might be most applicable for the Ministry of Health, in which case sometimes they are the owners of this data, and they will make sure that they have access to this data. But sometimes there are several ministries which are involved. I mean, as we have seen now here, you have data sets in different locations, and they might have different owners. So the combination of different stakeholders is very important, and we have seen this time and over again that it's difficult to coordinate between these different authorities, because nobody wants to hand over the data quickly, and they also think sometimes we are the owners, we want to change these data sets, you shouldn't touch them. This has always been a challenge. I mean, one of the things we put in place is this GeoPod site that you saw, which hosts all of the data which is relevant for public health, and then they try to source this from these places and put it in that location so they can use with it. So they can maybe not update it to doesn't go back necessarily, because the other stakeholders would not take the data that has been modified by the health ministries, because they think, you know, this is our data, we don't change it. But it has always been a challenge. So I don't have the golden answer for that. I think the most important thing is that you find the relevant people, you make them understand that what you're doing is concrete and makes sense to them as well, and that they're willing to work on it together. You can, depending on the infrastructure that you have in place, you know, there are ways of setting up a geospatial server where everybody can contribute the data, so that you don't have to export it and then it lives in many places at once. You can have one authority, ideally you have one authoritative source where everybody is pulling from and pushing to. I think that also goes back to what Anis was presenting. I mean, if you want to use AI or if you want to use tools to visualize your data and analyze your data, it is of crucial importance that the data is harmonized, because if you have data sets, as we saw all in the data sets that we got, sometimes the administrative boundary is written in one way, and then in another data set it has a slightly different spelling. if you're doing analysis on that, you're going to miss that link because maybe your synonyms are not exactly the same. So data harmonization is very important, and no matter how advanced your tools are to analyze, if the data itself is not in good shape, it's pointless. So first of all, you have to make sure that the data is in good state.
Yeah, thank you, Lucas. Panis, can you help to answer the first question?
Yes, it is interesting to differentiate between what is considered as a routine a disease that usually characterized by expected pattern or seasonal pattern that usually we can detect through routine surveillance or any public health programs. But then in a specific situation like outbreak, usually there is an unexpected increase, not only in terms of number of cases, but also the type or 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 group of cases by, for example, the population, by place, or by time that need rapid investigation and public response. So I think the most important is we need to have the baseline. We need to have the previous or historical data so that when we have, for example, a new cases, for example, twice higher than before, or any situation where previously no mortality occurred, but then there is a new mortality occurred. So we can consider this as a potentially outbreak for certain disease. So the government already set up several type of disease that potentially could be an outbreak, and there should be a specific public health surveillance mechanism. So in this kind of context, geospatial analysis will be very important because we could identify, for example, anomaly in terms of location. And if there is also data using the incidence data or address, and then we could also combine with the map, that could also possible to identify what is the determinant or risk causing this kind of disease. And if this outbreak could not be mitigated and the cases becoming higher and higher and also in the rapid manner, I think we need also to discuss other discussion. For example, if it is on the global level, there is also international consensus related on how to define it is considered as pandemic or not. So it is also a combination, not only from the epidemiological perspective, indicator analysis, but also in the governance level on defining this is routine disease, outbreak, and becoming potentially of pandemic. The third question related to the governance. I think, thank you very much, Lucas already explained a lot about the governance. Bu Vika, I think one of the most important aspect in our setting is how we could also ensure that there are a routine mechanism for updating and data sharing. I think 10 years ago, the number of district in Indonesia is about 400 something. Right now, the number of district in Indonesia, 541. And within the change of number of district, there will be possibility, a number of change of a sub-district and also village. And in this kind of village, we also identify that the number of population also increase routinely, dynamically. So I think we need to have this kind of mechanism of governance on how to ensure that data in the village level are consistent with the highest level. And I think this is also among the long story of, for example, the Ministry of Health say that in Puskesmas, the indicator of, for example, birth, the indicator of under 5, they manage the number by the calculation at the national level. But then in the Puskesmas level, they say that this number is not appropriate because this number could not be used in the village level because they would like to monitor in the village level. I think it is still a problem and yet finished in Indonesia. And this is not only about the number of denominator, like the number of population, but also like Lucas mentioned about the boundaries of area, boundaries of districts. So I think in this kind of a special method, the governance is very important, and especially when we are using AI, because we know that if we are not careful about using AI, if we are not controlling very well, the human in loop are not there. I think there are also possibilities that we will be using false or wrong source for decision making. Thank you.
Yeah, thank you, Pak Anis. Do you have questions from Zoom? Yes? Okay, can you please show question?
Yeah, Dr. Daniel, we have some questions from our online participants. The first one is from Federico Bosco. He asked, I think this is for Dr. Lucas. Yeah. So if shape files are not available for a specific area, what alternative approach can be used to proceed with geospatial analysis, and how analysts ensure the reliability of results when working with incomplete or substitute data sets?
And maybe we can continue with another, so we can collect some questions.
Okay. Yeah. Okay, and then the second question is from Warsini Handayani. I think this is for Pak Anis. She asked about, during the last pandemic, did FKKMK, the Faculty of Medicine, apply AI in its research or public health response? If so, could you share some specific examples of how AI was integrated with geospatial data for any public health response? Thank you. And then we have one more. Is it okay, Doctor? Okay. And then, we have one more from Federico Bosco also. The question is for Pak Anis. With multiple GeoAI and epidemiological platforms available, how can researchers and public health officials ensure they are selecting the most appropriate tool? And what strategies can be used to guarantee the reliability, validity, and overall quality of the results? I think that's all for Dr. Daniel.
Yeah, okay. Lucas?
Yeah, so absence of data is obviously a big problem. If you don't have a shapefile for what you're looking for, I think there's no real substitute, except for what you can do is, for instance, there are certain sources that will exist. Let's take the population as an example. If you don't have census data for your current area that you're looking at, there are alternative sources on a global level. So for instance, you have WorldPop as one source for population that gives you an option for the entire world. That may not be the best option, but maybe it is your only option, and that by default it becomes the best option, I guess. But so the point is, if you don't have the data set that you're looking for at that moment, maybe you can find an alternative source which is maybe less accurate than you wish for, but at least you have some data to work with. On the global level, there is, for instance, elevation exists. You have all the remote sensing, obviously, that you can use for imagery, etc. You have an extensive data set. Now, if it comes to very local level data sets, then obviously you would have to collect that on the ground with one of those tools that I either presented, or you could use ODK. If you're not familiar with that, it's an open data kit that allows you to collect data, and it's free, so it's open source. That's very easy to use, and it allows you to collect any data that you want.
Yeah, and thank you, Lucas. And for the second and third questions, address to
Okay, yes,
Panis.
thank you, Barsini, for your question. In the last COVID pandemic situation, FKKMK applied AI, but not for geospatial. I think if you knows and also have been diagnosed with Genus. Genus is actually an AI-based tool that could also be used to identify um, using a volatile organic compound. This is AI-based, but in terms of the visualization, I think the geospatial one, we have not yet adopted. Right now, our team also currently conducting a research using the umbrella of AI for PEP, and among the innovation is developing dengue, explain dengue. That means to explore the dengue data that is explainable to users. However, in terms of the spatial analysis, it is not yet there. But yeah, I think we have not yet implemented currently on several AI tools, but I think this one is promising, especially with the coming of agentic AI. And the question from Federico, I think anytime we are using any technologies, the most important step that we need to do firstly is to know the characteristic, the function, and the features. Usually it is available on their documentation on README files, etc. And usually they have also any kind of mechanism related to the validity score, the accuracy score, and this kind of information should also be understood by the users. Any kind of technologies, it's also important for users. If you have any problem or even, for example, curiosity related to the result, it is also among our responsibility to ask directly to the owner or founder of the program so that we can have a feedback give to them, and hopefully this feedback will also be useful to improve the tools. So I think any kind of technology, it is also among important part that users could also be contribute for improving the tools and technologies. Thank you.
Yeah, thank you, Panis. We almost reached the end of the sessions, but I have two questions to Lucas. Sorry, I have some questions actually, but I have two questions to Lucas. The first one is about the device that you developed. Can we use it in remote area without signal? Because in many areas of Indonesia, sometimes the phone signal is not available. And the second question is, do you have experience with the community science? So people are willingly, voluntarily participates in the data collections or in what effort to improve, let's say, the quality of the data.
Yeah, so the first one was if the tool works offline. Did I get that right? So yeah, the microplanning tool that I presented that we developed is entirely offline, and it basically syncs always back to whenever you reach connectivity, it will sync back the data. And the monitoring tool, the GTS, is only working with GPS coordinates, so you don't need connectivity for that at all. Once you have connectivity, you can upload the data. So that works also offline. Indeed, I mean, these are critical things for any sort of intervention in countries where connectivity is not great. And community contribution, I mean, there is OSM that you probably are familiar with, OpenStreetMap, where people are contributing all kinds of information about, you know, points of interest, etc., etc. There are road data sets. There is a lot of data sets that are available in OSM. The quality of those varies from place to place. For instance, in Switzerland, the OSM data is extensive and extremely good, and then you have some countries where there is almost no data. This works to some degree, but I think what we have seen is, for instance, what are called mapathons, where they say, okay, we're trying to get data for this area and we're going to create a project out of it, and we'll gather a few volunteers and they will just spend 2 days mapping as much of this area as they can, and they map it, either it can be done from remote sensing data. So for instance, they get images and they will annotate features that a human can see, or it can be done on the ground, but we don't have further experience in that.
Okay, yeah. Thank you, Lucas. I think that's all for the sessions today, and let's give a round of applause to both speakers. Thank you, Lucas, and thank you, Pak Anis. I hand back to MC. Yeah. Okay.
Okay. Okay, thank you, Dr. Daniel, and also thank you to our inspiring speakers for the very, very insightful lecture today. Please give a round of applause to our speakers. We would also extend our gratitude to all participants for joining us at the guest lecture. Your participation truly enriched our discussion today. And maybe before we conclude our activity, we will present an appreciation placard. We will present a placard to our speaker, and the placard will be presented by Professor Dr. Indah Kartika Murni to Dr. Lucas. So we invite Prof. Ita and Dr. Lucas to come forward, please. Yeah. Oke. Mungkin fotografernya boleh dibantu? Iya. Yeah, okay, we will take a picture. Okay. Okay, thank you. Please give a warm applause to our speaker. Okay, ladies and gentlemen, with the conclusion of the lecture session, we have now come to the end of our activity today. And on behalf of the committee, we would like to express our gratitude to all participants, speakers, and also a moderator who has contributed to this guest lecture. After we conclude the activity, please do not leave your seat because we will have a group picture together first. And then once again, I'm Rizky Adinda, together with the committee, would like to bid you farewell. Thank you and see you. Mungkin tambahan untuk yang tadi bertanya, Mas Atta ya. Nanti ada sedikit hadiah dari panitia, silakan bisa menghubungi panitia.